Depression is very common. People with depression absolutely get better. Therapy and medications are very effective. So if you're feeling depressed and you don't know what to do, reach out for help. My name is Dr. Laura Erickson-Schroth. I'm the Chief Medical Officer for the Jed Foundation. Today I'm going to talk about depression. One of the most important things in treating depression is having an open mind and being open to therapies that might be presented to you or other ideas that you might not have thought of. A lot of people who have depression really benefit from seeking out therapy or taking medications. For those people with more severe depression who need to seek out medications, about a half to 2/3 really benefit. Sometimes it can take a few trials of medications to find an antidepressant that works. So if the first one doesn't work, don't give up. One really important thing to know is that therapy and medications, when used together in combination, are more effective than either one is alone. Opening up to someone new about our feelings can be really difficult sometimes. But if we don't open up, we end up holding our feelings inside. One of the things about therapy is that a lot of people are anxious about it. And you can actually tell your therapist that. When you meet with a therapist, you can say, I don't even know if I can talk about my feelings yet. I just want to talk about how anxious I am about starting therapy. It's their job to listen to you, and they're really used to hearing about feelings. Therapy has been shown to help about 2/3 of people that seek it out for depression. In addition to therapy and medications, there are other things that have been proven to help with depression. One of those is exercise. Getting just half an hour of exercise a few times a week has been shown in studies to decrease depression. Another thing that's really important is feeling connected to community. Isolation can worsen depression, so reach out to family and friends, go to groups, engage in support activities. Research shows us that our brains actually change when we're depressed. We can see that on imaging studies. These kind of things have been shown with research to help with depression. Finally, what I would do is reach out to a primary care provider. Find out if there's anything else going on medically that might be affecting you and making you to feel depressed. One of those things could be a thyroid abnormality. Another could be a vitamin deficiency. Checking in with your primary care provider is never a bad thing. The thought loops that we develop when we have depression are really hard to get out of, and they can be easy to fall back into. That's why it's important to reach out for help when you're feeling depressed. There are good treatments for depression, and it's important that you meet with a mental health professional to figure out which is the best for you.